The palatine bones form floor and the walls of the nose and the roof of the mouth. The functions of the skull to protect the brain, give it face shape and provide a structure for muscle attachment to the scalp. The action of the frontalis muscle is to move the scalp forward and raise the eyebrows. Platysma is the muscle that draws the lower lip and jaw down and forms horizontal wrinkles in the neck. Masseter is the muscle that raises the lower jaw and aids mastication. Corrugator is the muscle that forms vertical wrinkles between the eyebrows. Orbicularis oculi is the muscle that clisses eyelids. Sternocleidomastid is the muscle that causes flexion and rotation of the neck. Orbicularis oris is the muscle that allows the mouth to close and kiss. Buccinator is the muscle that compresses the cheeks and aids mastication. Risorius is the muscle that retracts the corners of the mouth into a grimace. Zygomaticus is the muscle that draws the angle of the mouth upwards when smiling and laughing. The end of a muscle that attaches to the bone it moves is called the insertion. Origin is the place where a muscle attaches to a bone but does not move. The skin helps to keep the body warm through erector pili muscle contraction. Sebum is deposited on the surface of the skin to help keep it moisturized. Melanin helps to prevent radical damage from UV light in the dermis. Excretion describes the delivery of waste products onto the skin's surface. Oils and medication substances can be absorbed through the skin. Pain and pressure receptors in the skin send messages to the brain to help prevent potential damage or injury. The skin produces vitamin D when exposed to UV light. If your client has an underactive thyroid, their skin may be dry and coarse. The rhythmic pumping of blood around the body is felt in the wrist and neck as a pulse. Circulation of blood to and from the lungs is known as pulmonary. The force at which the heart pumps blood to the body is measured as blood pressure. The functions of blood are protection, heat regulation, clotting, and transportation. Arteries are different to veins as they have thicker muscular walls and carry blood away from the heart. Capillaries are vessels that are 1 cell thick to allow gaseous exchange to take place for cell renewal. Veins differ from arteries as they have valves and carry deoxygenated blood from the body back to the heart and then to the lungs. One function of the heart is to pump oxygenated blood to the tissues. The lymphatic system fights infection and reduces swelling. Lymph nodes filter harmful substances. The tubes that carry lymph are known as vessels. Plasma that seeps out of the blood vessels into the surrounding tissues to become tissue fluid is collected by lymphatic vessels where it is becomes lymph. The central nervous system responds to information picked up from the internal and external environment. The unconscious muscle contractions in the body are controlled by the autonomic nervous system, the area where the nerve supply enters a muscle and stimulates an action is known as the motor point.